Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a very special guest today. This is Natalie Masa. She's a third year High Point University student, original from Naperville, Illinois. She received her bachelor's degree in exercise science from the University of Iowa, where she also played college soccer. She's a certified strength and conditioning specialist who plans to work with athletes in the future. She enjoys playing sports, hiking, music, good food, and spending time with friends and family. So, Natalie, I am so excited about this podcast with you today.
Thank you for having me.
Absolutely. Thank you for being with me for, man, 12 weeks this week, at the end of
I
this week
know.
already. And has been a great having you. So, thank you again for that. And thank you for wanting to do this with me.
Of course, of course.
So tell me the story of how you end up in oncology rehab clinic for your internship.
So originally, I was actually I had a clinical rotation for set for an outpatient ortho for my first 12-week rotation, and something happened. Things fell through, so then I kind of had to scramble and find a new rotation. And like looking at the map that the school gives us of all the locations that we can kind of choose from, there was only like vestibular, a couple neuro spots, and then two cancer rehab clinical rotations, one being here, one being a different spot. And I was in Atlanta before this, so this was actually just kind of the closest spot. And that's just kind of how I ended up here.
So that was an area that you ever saw yourself going into?
No, I've always been really interested in sports, and I kind of had my mind set on that. But um, and also like in school, we don't really get exposed to what oncology rehab is, and at least at my school, it wasn't really talked about much, so I didn't know like anything about it. And when I saw it on the list, I was like, oh, that seems really cool, really interesting. I might as well try it for one of my specialty rotations. So I'm really glad I chose it. That's for
Awesome.
sure.
Yep. So do you remember your first week? What stood you either in a good way or something that made you think, wow, this is different?
First week was yesterday and also a long time ago. I think the first week I was kind of just like, oh, I have a lot to learn. It was just like, whoa, I don't know anything really. So it's kind of more of like a catch up, learn quickly for me to be like a successful and productive member of the clinic. Um, so I think like we spent the first 2 to 3 weeks kind of learning all of the nitty gritty details, which was really helpful because then we had, or at least I felt like I had a strong foundation that I could build off on for the following weeks. So I think that was my initial, what stood out was like, whoa, I have no idea what I'm doing. And then also the first day, so Monday, every Monday we have our breast tumor board meetings. The first thing that I had for my internship was that. And I was like, oh my goodness. It's like, what is this? Like,
Yep.
in outpatient, you don't get to interact with any other really, you don't get to interact with physicians all that much. So meeting with surgeons, medical oncologists, radiation oncologists, plastics, that was a whole like, whoa. And it was really unique and really cool. And
Yeah.
ever since then, I've enjoyed that. Yep.
Great. And you're right. Unfortunately, most of you guys internships start on a Monday, and every one of you comes at 7, and it's like you're already kind of like, nervous, right? It's a new internship, new something, and then you realize, I know I don't know that much, and then you come into that tumor board and you understand maybe two or three words out of the 100 words that has been done
Yeah.
for an hour and a half. And that's when you're like, holy cow, what did I get into it, right? So I always tell students, this is absolutely normal. Don't feel overwhelmed. You're gonna see
Yeah.
Monday after Monday after
It
Monday,
just makes more sense.
you'll just really grab the whole thing. So,
Yeah.
um, what is something you thought you understood from school until you saw it in person?
Well, kind of like I mentioned in school, the most we learn about cancer is very limited, but what we do learn is more of how to identify the red flag signs and symptoms if a patient were to have cancer, and like it went undetected. So that's about the most we really learned about it. We kind of discussed a little bit, um, like we discussed what it looks like slightly working with cancer patients, just like making sure they're getting enough exercise, staying active, but nothing really specific in terms of like this is what it would look like to treat this cancer. What about this cancer? And like we discussed a little bit of contraindications as well, for certain modalities. But we did discuss lymphedema a little bit more, but it was more in terms of heart failure. So that was also a little bit different. So I felt like I had a good understanding of what lymphedema was, but having a patient come in with lymphedema was like totally new. Like you think you know what it looks like until it's right in front of you, and you're like actually having to perform MLD, CDT on the arm. So I think that was something that was kind of surprising.
Okay. What is something you thought, sorry, what kind of patients are you seeing most often and what do they usually need help with?
So we mainly see breast cancer patients, and then after that, I would say head and neck cancer patients, and then other, which would be all of the other cancers that we see, brain, lung, things like that. So for breast cancer, I think, post mastectomy and lymph node dissection, majority of them struggle with motion. Um, that being the big one, and then also like scar adhesions, fascial restrictions. I've seen quite a few seromas, a little bit of lymphedema, muscle tightness, especially in like the pec muscle, subscapularis, and then head and neck. I feel like after neck dissection, they mainly struggle with swelling and then jaw range of motion. I feel like that's one of the biggest obstacles for them to kind of overcome.
That's right. And a lot of this, depending on the patient, right? Spinal extracellular
Right.
nerve
Yeah.
situation. And the one thing, as well as you mentioned, right, with breast cancer is a huge correlation with breast cancer related lymphedema. So we have the
Yeah.
surveillance program where we identify early onset of lymphedema. So hopefully we can capture on time and reverse it. That's the whole point, instead of become chronically.
Right.
So that's what we wanted to try to do that. Um, has anything about the oncology population really surprised you?
Um, the biggest surprise was actually the overall like adherence to PT, um, that the patients have. Like I think with the crazy amount of appointments that they have to go to, um, it's great to see them show up and give their best effort for that day, no matter if they're in pain, they're super fatigued. Um, Majority of the patients are always ready to work when they come in, and I think that was the most shocking to me because honestly, there's better adherence here than in outpatient.
It is. It is
Or
sort of.
no, yeah.
You're
So
absolutely right. I like I mentioned in the past to some of the audience. Most of you know I used to do orthopedics for many 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 years. And that was one thing that thoroughly captured my attention is the patient, is how compliant they are, how much, no matter how they feel and what they go through, from weight loss, losing their hair, scared that they're gonna die, all the side effects from chemotherapy or radiation. Most of them, I would say 95% of them, are ready to work, and most of them feel so much better after we see
yeah,
them,
yeah, for
for
sure.
the most part. So
And also props to you because you schedule around their schedule.
Uh-huh.
which I think is really
Hmm.
great of you. So,
Yeah, yeah, yeah. Otherwise, like you said before, right? They get overwhelmed
right.
with appointments. So why make them wait when we don't have to, right?
Yeah.
So that's kind of the good thing for us to, as much as we can. Sometimes again, they're like more like it's okay, I'll just wait an hour. And sometimes it's me like, no, I don't want you to wait an hour. Let's
Yeah.
try to get you in a different times. But yeah, so um, is there a moment where you thought this is why this specialty matters?
I don't think there was one exact moment. It was more of like a accumulation of like small moments. Um, seeing multiple patients come back after you just worked with them last week. They come back, they're like, "Oh, I feel so much better this week." Um, they're going back to doing the activities that they love. They have way more range of motion when you measure them. So, like, objectively, they're doing much better. I think, like, the small wins like that kind of help, you know, let you know as a clinician, oh, I'm doing the right thing. What I'm doing actually matters. Um, yeah.
So you think that any therapist can just go ahead and treat this type of population, or you really feel like definitely glad that now we're a specialty and we're part of an APT specialty
Yeah.
clinics. So you feel like anybody can just step in and just learn to do how to do some kind of like manual lymphatic draination, some wrapping, and then you should be good to go.
No, like, I think it's much deeper than that, and that the way you communicate and interact with the patients really matters, because we do spend so much time with them, like 45 to an hour. That's a long time. Um, I feel like you can kind of skim by in outpatient ortho if you're, not great at interacting with patients. You really have to get to know these patients. They have a lot on their mind. They want to share, they want to talk about, which
Mhm.
is great that you can be kind of that listening ear for them and have that compassion for them. So I think that's something that, you can't just throw any PT into and then,
Correct. Yeah. And I think as well was really fascinating the other day. And again, everybody is different, Natalie. And then you have this confidence that even though if you feel inside like, oh my God, I don't know anything, but you don't show that. And you just really show very confident with the patient. And I think it was last week or the week before we had a patient who was just kind of really anxious about hearing from the news, from the path report from the doctors, and really getting frustrated not hearing from them. And you just took on your own and say, well, let me look at the report and see if it's there. And oh, the report is there. Let me give you some, let me easy you up. I don't think you will be able to do anything like that at all, you know,
yeah,
even, you know, 6 weeks before or five
right,
weeks
right.
before. Like to get to the point that you feel confident that you are like grabbing a report that you're going to discuss with the patient and hopefully be able to answer most of the questions.
Yeah,
And again, some things we are not the pathologists, we are not the physician, but you hear as much on tumor board and from chart reviews and from patients that you actually have the opportunity to let me get this information, explain to you what I understand from this information. Of course, you need to wait until they call you and they clarify and they'll get together for tumor board and make further decisions. But
right.
the patient felt much better after. You were like breezed through it. I was like, oh my God, this is awesome because not everybody has the confidence to do that,
Yeah,
right?
yeah.
So that
I,
was very
I totally agree. I wouldn't have been able to do that at the beginning.
good. Without saying, sharing any personal details, can you tell me about a patient interaction that really moved you or stuck with you?
Um, well, I think in general, the kindness and like appreciation that the patients show us like on a daily basis, is really special. Um, and I think it'll always kind of stick with me. They're going through a really tough time, and they don't have to be in a good mood when they show up. They don't have to be nice or kind to us, but they almost all of them are, I would say, and it's really nice, to kind of feel appreciated, feel like you're helping someone. um, and we do have patients with, I would say, worse prognoses than others, and they still show up every day, continue to be positive, not knowing what the future holds. And I think that, kind of really will stick with me, and kind of has affected my perspective on life, I would say.
Mhm. That's correct. Um, sorry. Do you ever find yourself learning from your patients? And what's something that they have taught you?
Yes, I absolutely learn from my patients. Kind of like I just mentioned, like their positivity and perseverance is something that I try to implement into my own life. And then early on in the rotation, it was really helpful to hear the patient experience. So, like side effects of hormone blockers, what the fatigue feels like, what kind of common areas of pain are happening, how's radiation affecting their skin. So all of those little details and like their own personal experience kind of helped me put together the pieces so I could ask, more specific questions to each
Mhm.
patient based on what their current treatment looks like. So I think that was really helpful. Um, and they teach me new things every day. I just heard of a new chemotherapy drug today. So,
Okay.
yeah.
Yeah, that's correct. And again, the majority of the patients are so engaged with it
Right.
that they actually many times is like, what I've been researching on this drug, or I've been researching in this new trial.
Yeah.
Have you heard of it? What is your thoughts about it? And some things I'm like, I have not heard about
No.
it. Let's look into it
Yeah.
and we can discuss a little bit later. So yeah, they always keep you on your toes.
Yeah.
Um, what is like learning from experienced oncology therapists? Any wisdom or quirky phrases that stick with you?
I think it has been a great and awesome experience overall. Um, Honestly, like I don't know how many really truly experienced oncology PTs there are in the U.S. Um,
It's
and
not
I
that
was,
many.
yeah,
We're growing. We're
you.
growing. We're growing.
So when I was thinking about it, I was like, oh my gosh, like, because you've done oncology for what, 10,
17 years. Mhm.
17 years? Okay. So I can't imagine like how much extra research and how much you had to look into
Mhm.
everything to kind of find like the gold standard for measurements, tests,
Mhm. Mhm.
surveillance. So it's awesome to learn from, one of the trailblazers and not to boost your ego too much,
Okay.
but yeah, but that has been great. And it's not a phrase that you say, it's a phrase that patients say to you. They're always commenting about how hard you're going into their soft tissues, and
Fingers.
they call you fingers. Yep.
Mhm.
Um, and how strong your hands are. I think that is something I will kind of remember, because just because they have cancer, that doesn't mean they're delicate and fragile. Um, they kind of actually appreciate it when you get in there and really get after it, because they want to get better. Um, so yeah, that's something that'll be sticking with
So
me.
all my nicknames from patients, they actually start doing a list of all the nicknames that patients call me.
Yes.
Um, has this setting changed the way you think about fatigue, pain, or recovery?
Um, I would say yes. Um, Cancer related fatigue is much different than like normal fatigue. Honestly, I hadn't really heard much about cancer related fatigue before I got here, but um, after learning more about it, it's obvious that it doesn't react the same way to rest that normal fatigue would. Um, and then in recovery in general, it's very non-linear. And that's why we do the surveillance. So years down the road after radiation, they can start to have fibrosis, or maybe they'll start to develop lymphedema, anything like that. So yeah, in terms of recovery, um, yeah.
If it's any skills that you find yourself using more in oncology rehab? Hands-on techniques, communication, creativity, patience. Patience.
Patience for sure, but I think that's applicable to
Anything.
any
Mhm.
healthcare field, I would say.
Yeah.
Um, Hands-on for sure. I've definitely developed my manual therapy skills here, um, which isn't something I was expecting to do, but I'm really glad that I did. You taught me so many different cool little tips and tricks, and yeah. And then communication is a huge one. Communication slash education, I would say,
Yeah.
because we do spend a lot of time answering their questions because they don't always get, the same amount of time to spend with other healthcare providers.
That's correct. What skills are you finding? I'm sorry. What has this setting changed the way that you think? No, 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 no. I'm like totally out. Um,
It's been a
let's
long day.
after being yeah after the holiday, right? Um, what is something you can do now that you couldn't have imagined doing confidentially a few months ago?
Well, kind of like you said, overall, I'm more confident in myself, more confident in my abilities. Um, at the beginning, I remember we had an eval for a patient with multiple metastases, and I wasn't confident enough in myself. And I was like, "You got it. I just want to watch you do it." So you did it. Um, and then I think last week or the week before, we had a patient who came in with a brain tumor. It was already, surgery had already taken place, but it was an eval, and we were double booked. So you were kind of busy, and I was just kind of thrown thrown to the wolves, I would say. And but it went over fine. It went smoothly,
Yeah.
no issues. So yeah, I never could have imagined because we haven't seen a brain tumor.
Correct, correct.
Yeah,
And again, usually, the rule of thumb is like you are not gonna see something on your own until you have seen it with me and
yeah,
coach with me. But no, the advantage if we kind of chat about what's gonna happen with the patient, so you kind of already knew, prepare a
right,
little bit. But at the same time, it's kind of like I could do two things. I could either say, no, let me take it and you see the other patient, but I knew it wasn't going to be another opportunity for you to see a brain
yeah,
type of cancer. So I'm like, she has the principles, she has the foundation. So no matter what type of cancer comes to you, you already know the
right,
foundation. So that's what matters. And
yeah.
you did it great. That was very good.
Thank you,
Yeah,
thank you.
yeah, yeah. What do you wish people knew about exercise during cancer treatment?
Oh my goodness, that is good for you. Um, it's definitely a common misconception that you have cancer, you need to rest, you need to let your body recover, um, which is completely wrong. Really, the research basically shows that exercise in conjunction with chemotherapy, radiation, um, really increases the efficacy of these treatments. To be specific for any listeners, exercise can help reduce cancer related fatigue, which kind of seems counterintuitive, but it's true. It's shown to increase the amount of blood flow to the tumor, which then in turn allows for the chemotherapy drugs to reach the tumor. Um, and much more helps with deconditioning, which we don't want.
Mhm.
Anything and everything is great.
Exactly. A lot of skeletal muscle mass
Yes, yeah.
because it's a lot of use just, with mainly hormone blockers or
Mm-hmm.
endocrine therapy as well. So helps a lot with that part,
Yeah.
big time. Have you noticed any other misconceptions with patients often come with?
Um, it's not a misconception, but I think that patients often come to their pre-op appointments kind of like confused as to why they're there, or maybe they do have a misconception about PT in general, about what we do. Um, so sometimes that can make it difficult to get a full, good, subjective past medical history out of them.
Mhm.
And to me, that kind of in turn can make our can hinder the way that we're able to treat them if we don't know everything. If I don't know your full background, like if I'm missing something huge, like if you have osteoporosis
Mhm.
and I'm going to do um, a spinal manipulation, I should know that, so I don't know. I think things just like I'm hoping in the future that oncology rehab will become more recognized so patients don't have these misconceptions when coming to their pre-op appointments. Um, and then, just hoping that I know we're kind of working, or you're working on it right now with the marketing team, kind of getting more information out there to the general population. So,
Exactly. And I think that a lot of the things as well, and I'm gonna link into the next question, is gonna be how much curriculum you guys learn in the school, because I think it's not really that much. And I get it. It's so many things that you guys have to learn
yeah.
during those 3 years, but definitely oncology is growing, and it's growing just because we are having great treatment. So we have a lot more survivorship.
Right.
So we have more survivors even on your regular outpatient ortho. You're gonna come across patients who had a history of cancer.
I did, yeah, I did
Uh,
come across a few in my
yeah,
other rotation.
exactly. And then if you compare yourself what you know now versus how you handled back then, I can guarantee you're like, dang,
Yes.
I should just totally really treat these patients in a completely different way.
Yeah.
Right? Because I did it the same way. For 20 years, I worked on ortho, and I was like, oh, you have a history of breast cancer. That was a while back. It's
like,
not you don't really have it anymore. There's no reason why I need to be worried about any of this. And I just move on and do everything
yeah,
else
you
I
just
was doing.
breeze over it.
Exactly.
Basically.
Yeah. It's no red flags. Right now, you don't have active cancer, then you should be fine. You're taking these pills, hormone blockers, and you should be
Cool.
fine. Okay,
Don't
you
know
have
what
hot
that is.
flushes.
Yeah.
Sorry about that, and just keep going, right?
Yeah.
So again, completely different ball game. So again, I think that that's why it's so important for this type of specialty to start to be more insert in the PT curriculum, which is something I always ask, and if I ever get any calls from your school and say, well, what else can we do to improve our program? That's exactly going to be what I tell everyone. It's like, I think we need to start putting more and more in the curriculum.
I mean, we have classes for every other specialty but oncology. Like we have full classes. We had a primary care class, which is relatively new and basically just starting up. We had three, I would say, acute care, like CVP, acute care courses, three neuro courses, which is a big one, but it is a specialty technically.
Mm-hmm.
Zero, zero oncology.
Yeah,
So
yeah. So hopefully that's something that we'll hopefully see that coming.
Yeah.
If another student is considering oncology rehab, what would you want them to know?
I would want them to know that they need to be flexible because things are always changing. Um, just in general with cancer, things are always changing. And then, the clinic, we don't have that many oncology specialists. And, we have a lot of patients that we have to see. So, you know, patients get thrown around. Oh, you're going to see them, and then double booked, which is pretty normal. But and then also don't be afraid to ask questions. I think I learned a lot within the first few weeks just from asking the questions about what are you doing, like in the moment, things like that, and things that I didn't understand. But also being able to research on your own is important. There's oftentimes I had a list in my little notebook of just phrases, just words that I had no idea what they meant, so I had to Google all of those. And then probably just that oncology is a very rewarding specialty um, because even like the small interventions that we can do can make a huge difference for the patients.
That is so correct. And for any cancer patients listening, what would you want to say to them?
Well, like the name of this podcast, taking charge of my cancer. I think the main thing is don't let cancer become your whole life. Um, I saw a quote last night actually that said, "You can't add more days to your life, but you can add more life to your days."
I love it.
Yep, and it's probably really cliche, but
Hmm.
um, I truly believe that the patients who don't allow cancer to kind of become who they are, they thrive and really, um, have the best outcomes. And there's much more to you as a person than just a diagnosis. So
Correct,
yeah,
correct. And sometimes, for any patient out there, we don't know what's going to happen with us tomorrow, right?
yeah,
We can only know what is happening today, and that's why you gotta take advantage of life, not just for cancer patients, in all of us. We sometimes we get so worried about so many things, and at the end of the day, it's like we spend more time being worried than actually enjoying life.
right,
So why
yeah,
not doing the opposite and just enjoy every moment of everything? We have some patients who says, they're in the worst situation from everything from cancer, they learning how to speak to a tray, or stomach, and they are economically not doing well because they cannot work. And even with that, they're calm and throw jokes, and it's like, well, what else can I do, right? I need to have fun, right? In the
yeah,
meantime, and they taught me so much
yeah,
in like every day.
yeah,
It's like, no, I shouldn't be complaining about this neck pain I have,
right,
or
yeah,
this little small stuff, like as I always say. But yeah, so definitely we gotta really stop complaining so much
I
and
agree,
enjoy life more.
I agree, yeah.
Yeah, 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 absolutely. So that has been a pleasure, super fun having
Thank
you,
you for having me
not just on
on.
the podcast, but as well these past 12 weeks. And I know you will do great. And I always say to my students, I know you want to do sports and I know you want to do ortho. I get it. But, my mission in life is convert every one of you in oncology specialist. So who knows? Who knows what's going to
You
happen?
got one student. You got two.
Yeah, that's right. Two students
Yeah.
here that are
Wow.
doing oncology. So yeah,
I
so
would. I'd never say never. I really enjoyed my time here.
awesome.
Seriously.
Awesome.
Yeah.
Yeah. Yeah. So thank you. Thank
Thank
you
you.
again. And see you guys later.